Good morning. God
Good
bless you
morning.
and welcome. And welcome to the MIMIT Health Live Life Free Fibroid Health Talk. Good morning. I'm Sandra Robinson Cunningham, and I'll be your host for today. We got some exciting news to share with you, ladies, and I'm really excited to have both these wonderful doctors on the call with us on today. So we're going to talk about fibroids, and that means we're going to talk about everything you need to know about fibroids. Not only about the fibroids, but we're also going to talk about your options and the non-surgical options as well. So this is the day that the Lord has made. Let us rejoice and be glad in it. Now, I want to share something with you from MIMIT, and I want you to know that MIMIT Health is here to serve you in the best way possible. Take a look.
Welcome to MIMIT Health. We're one of the fastest growing physician groups and health system in the country, and we are here to serve you. We specialize in minimally invasive procedures, whether it's spine, arteries, veins, prostate, fibroids. We do a wide variety of things, but we're here to solve your problem for you. We have some of the most highly talented, qualified, humble people who are here to serve you. We believe in servant leadership and to care for you.
We are ready and available to serve you now. Call 708-486-2600. Telehealth services are also available.
So ladies, we're gathered today to share with you the information about fibroids. And of course, we want you to know that we've got you covered. We got information. We're going to talk about the symptoms. We're going to talk about the most important thing for you, surgical options for relief. Now, before I get started, a quick question for you. Ladies, would you take the opportunity right now to click on the polling question on your screen for me? To get started, we want to share with you a story from a young lady. And quite frankly, her story will probably sound familiar to a lot of you. She's going to talk to you about her experience, and she's our patient advocate. Please welcome Miss Tony as she comes.
My name is Tommy. I'm a registered nurse. I work in the hospital. I've had an experience of fibroids for a couple of years. So during the course of the fibroids, when I was having it, I will be having like a shortness of breath because my stomach is like up into my epigastric area, and each time when I eat, I'll be having nausea. Sometimes I even vomit. So it's kind of very frustrating thing for me. So when I discussed with one of my friends, he introduced me to Dr. Chopra. So the date was set for UFE. Afterwards, after 2 to 3 months, I started having a little bit relief. Like I'm not going to the bathroom anymore. Not frequently like as it used to be. It's reduced from the preparation room to where the procedure. The whole thing did not take more than like 3 to 4 hours, and I was discharged home. No nausea, no vomiting, no bloating, nothing like that anymore. I'm free. So I would recommend it because it's not invasive, that somebody will be caught, that you will be nursing a wound for months, and at the same time, I've seen people going through those procedures like having a surgery that do not make it. I think this is a very good procedure for women that are having fibroids.
With some of the things that Miss Tommy talked about, because once again, that's why we're here today. We're here to talk to you about those symptoms, and we're here to do two things: to get you the information and to also tell you about the non-surgical options. And just like Miss Tommy said, today is your first step so that you can start your process to being fibroid free, or as Miss Tommy said, free. At this time, I'd like to introduce a friend of mine who is joining us. She's a good friend. I've known her for many, many years, and now she's popping in to just greet the ladies and talk to you a little bit. And I got to say congratulations to her because she just recently got named Majority Caucus Chair. It's none other than Ms., of course, Senator Maddie Hunter.
Thank you so much, Minister Robinson, for those kind words.
Good morning.
Good morning, ladies. I am so pleased to be here with you this morning for this important discussion on uterine fibroids. Taking some time out of your morning for this health talk decision, one that could save a life. We all know about disparities African American women are experiencing, and African Americans in general are experiencing related to our health, especially during this pandemic. We are more likely than Caucasian counterparts to get COVID-19, to have diabetes, heart conditions, and yes, fibroids as well. Research shows that Black women are 80% more likely to have uterine fibroids than women of other races. Let's face it, you're here for a reason. We've all been there. Heavy bleeding, debilitating pain every month. And the only option that has been given to us is surgery. As women, we need to start taking charge of our lives. The more we know, the better decisions we can make with our bodies. We need to be better informed about what we can do and what our health-related options are. Coincidentally, my sorority sister and vice presidential candidate, Kamala Harris, just introduced legislation to support uterine fibroid research and education. And I am so excited for what this could mean for women's health. So I want to thank you, Dr. Chopra, your staff, and all the churches involved in making this health talk happen today. Let's all get educated, ladies. Thank you and have a beautiful day. Thank you.
Thank you so much, Senator Hunter. We appreciate you and God bless you as well.
God bless you.
All right, ladies.
Thank you. Thank you.
You're more than welcome. All right, ladies, so we're going to kick things off and we'll get started. I do want to remind you too that this is going to be interactive, so there'll be times when I'll ask you to do other things. But right now, I'd like to introduce the doctors to you, and these are the men of the hour. And of course, it's Dr. Romi Chopra, interventional radiologist and CEO of MIMIT Health, as well as Dr. Samir Ahmed. He's vascular interventional radiologist with MIMIT Health. Good morning, gentlemen.
Good morning.
Good morning.
Good morning. Thank you so very much for being with us on today. And I know during this COVID situation, we would really love to be in front of the ladies and actually see their beautiful faces. But since we got this situation going on, we're just excited to be able to do it virtually, okay?
Absolutely.
Absolutely. Now, I do want to remind the ladies, if you have a question before we get started or during the process, I want to make sure that you would click onto your Q&A on your screen and you can submit any question that you would like. And by the end of this session, I'll pop in and we'll do questions with both the doctors, okay? All right, so let's get started with Dr. Chopra. Now, Dr. Chopra is known, ladies, as the tell it like it is guy. He tells you all the information. I love him because he tells it like it is, and he's so personable with it. And you know, when you're going through this type of situation, you need to have somebody that's not just going to treat you like a number. Dr. Chopra is going to tell you like it is, and not only that, he's going to make you comfortable with everything that he has to provide for you. So today we're going to talk about fibroids, and Dr. Chopra will give us all the information. So let's start with the questions.
Yes, please. Thank you.
All right. So Dr. Chopra, here's our first question. What are uterine fibroids, and are there different types of fibroids?
Absolutely. If I may, I'm going to share my screen and
Sure.
share a presentation with you. Give me one moment so I can make this happen.
Okay.
So, you know, uterine fibroids are essentially, I don't think I can share my screen, but that's okay. So uterine fibroids, before you understand a uterine fibroid, you really want to understand what the uterus is. So I look at this as a woman is the center pin of our existence. Children. And the uterus is like the garden. I call it the garden of life. And what happens here is that every month our bodies, especially for women, get ready to have a child. So it's a 4-week cycle. A pregnancy, then obviously you have a pregnancy. If not, there's menstruation and the uterus cleans out. The uterus normally is the size of a fist, just that small. And during a pregnancy, it's got to take in a whole baby. So it's a very flexible muscle. We call that the smooth muscle. That smooth muscle, if the fibers get out of place, so to speak, they can develop into benign, that means they're not cancer, tumors. A tumor just means like a solid ball. They can be of different sizes. And what they then do is they make the uterus get big, but they make it, you bleed a lot more during menstruation, a lot of cramping, a lot of pain. If they get very big, they can put pressure on the bladder, so that's frequent urination. They can put pressure on the colon and there's constipation. But most of all, sexual activity is very painful. So benign tumors in the uterus from the smooth muscle, that's fibroids. I'm sure you'll have questions about how people feel, etc., and I'll continue there.
Okay. So now what causes uterine fibroids?
It's very interesting. There's been a lot of research, and there isn't a very one clear factor.
Really?
A lot of it is genetic. I've seen it where the grandmother, the mother, the daughter, they've all had it, especially in African American women. We've heard even scenarios where there's some research that said something to do with hairspray, but I don't think it's related.
Hairspray.
Hairspray, but I don't think it's really related. It's genetic. Interestingly, men in their prostate get a similar problem. It's called benign prostatic hypertrophy, and age. And in uterine fibroids for women, that's the biggest challenge. At one point, as many as 800,000 hysterectomies were done a year.
Wow.
Still that many. But coming back to it, there really is no single factor that causes it.
800,000.
At one point, they've come down a little bit, but still a very large number.
Wow. Dr. Chopra, how common are uterine fibroids?
Oh, it's very common. 80% of women during the childbearing age will have some form of fibroids. And what's important to realize is if somebody just said, hey, you have a fibroid, it doesn't mean it's a massive problem unless you have the symptoms and it's affecting your life. Some women find out because they have heavy periods, but they've always have had heavy periods, and they may not do much about it. They think it's normal. Then they can't have a pregnancy. They go get a checkup and they find out, oh, you've got fibroids. So for most people, this is really when they have some problem, they get examined, they get an ultrasound, and now you have a fibroid.
Wow. And my last question for you, Dr. Chopra, is what symptoms occur with fibroids?
So heavy bleeding and pain during menstruation, that's one of the commonest. But bulk symptoms, I've had patients who thought they were just one pregnant or they just put on weight, but actually it was a big fibroid growing inside.
Wow.
I have others who bleed heavily. They suddenly are weak, anemic. Most mothers are working, taking care of kids, family, the husband, the biggest child in the house usually. And then from all the other things, they have one or two jobs. And then to bleed and be anemic, that's not really fun for them. The other thing that tends to happen a lot of times is they may have a miscarriage and not realize why that happened, etc. So those are the common varieties.
Wow. Well, thank you, Dr. Chopra. I am sure that a lot of the women can identify with the symptoms that you just spoke about, and thank you for sharing that information with us. Well, ladies, now we're going to move over to the options for you, and to do that, let's speak with Dr. Samir Ahmed. Good morning. How are you?
Good morning, Sandra. How are you?
I'm blessed. And of course, ladies, he's the vascular interventional radiologist at MIMIT. And he's going to talk to us today about the non-surgical options, because I know plenty of you, and we hear it all the time, that the first thing people say is, or some doctors have said, are hysterectomy, hysterectomy. Well, today we have some non-surgical options, non-invasive options to share with you. So let's get started with Dr. Ahmed.
Excellent. Thank you,
First
Sandra.
question.
I'm going to try to share my screen here.
Okay, perfect.
Let's see if this works.
Yay.
Can you
Got
guys
it.
see it?
Yes,
Okay,
absolutely.
excellent. So Senator Hunter actually brought up a great point. You know, there are a lot of disparities in for African American women, and a third of African American women will end up with a hysterectomy. And yeah, I think the unfortunate part is the lack of information out there on what are the options. And a lot of physicians are not aware of all the options. And I think, you know, patients often go to their gynecologist for advice on how to deal with uterine fibroids. And they are provided with a set of options such as dietary therapy, hormonal therapy, and then some of the procedures that gynecologists are very comfortable with because they do it themselves, such as myomectomy, hysterectomy, and I can talk a little bit more about that. But a lot of gynecologists are unfortunately just not aware of uterine fibroid embolization, even though the American College of Gynecology has given this treatment, fibroid embolization, its level 1 designation. So it's considered a first line treatment for fibroid for treating uterine fibroids. So this is a nice graphic. It shows the spectrum of treatment. So you have you know, there's a lot of information out there on the internet about what you can eat, how you can modify your diet to help with uterine fibroids, and there's just not a lot of good data to support you know, dietary management of fibroids. There's hormonal therapies such as Lupron, which is basically a pharmacologic way of inducing menopause. So that is one option out there. But again, you know, it's a very extreme change in one's lifestyle. And then on the other end, you have these surgical options such as open hysterectomy, laparoscopic hysterectomy, myomectomy, which can also be done open and laparoscopic. So hysterectomy is, of course, taking out the entire uterus. It involves a large surgery. So there's a large incision that's made to open up the belly as well as the pelvis. And then the entire uterus is cut and taken out. Of course, there are a lot of risks associated with any type of open procedure, especially one of this magnitude. There's a high risk of bleeding, infection. There is a long hospitalization that's often associated with hysterectomy, up to 5 days. And the other thing is that, you know, the uterus is very precious territory.
Mm-hmm.
So there's a lot of, you know, precious organs and structures that are next to the uterus. For example, the connection between the kidney and the bladder, which is called the ureter, runs right along the uterus. So you can imagine that if you're doing this large surgery, that structure is at risk for being damaged. And I've seen, you know, from my experience, I've seen many women end up with damaged ureters, and then they end up living with a tube coming out of their back because they can't
Oh,
pee normally.
oh
So
my
that,
God.
you know, the hysterectomy, again, I don't think it's a procedure to be taken lightly. Again, it's a pretty involved surgery, and again, very high risk of bleeding, infection, and damage to adjacent structures. Myomectomy is another option. So essentially, a myomectomy is where you try to target some fibroids for removal. So essentially, you go in and you shave out whatever you can of the fibroids that are essentially, you know, very accessible.
Okay.
But a lot of fibroids are not accessible because most of the fibroids, the vast majority, actually live in the meat of the uterus, which is
Mm-hmm.
the inner musculature of the uterus, and those are very hard to get from doing a myomectomy. And again, it can be an open procedure or a laparoscopic procedure, but it is an involved surgery. It requires hospitalization, increased risk of bleeding, infection, etc.
Sure.
And then we have uterine fibroembolization, which is a minimally invasive option. So I'll talk more about that. So let's see if I can go to my next slide here.
And that's the UFE treatment, correct?
The UFE treatment, uterine fibroembolization.
Mm-hmm.
So let me give you an example of what I'm talking about. So when we're talking about open surgery versus minimally invasive options, the principle, before I move on to the slide, the principle for a uterine fibroembolization is that fibroids are very vascular structures. They essentially grow because they try to suck in as much blood flow as possible, and that's why they also are associated with heavy bleeding. You can consider fibroids to be kind of like the weeds in a garden. So, the uterus is like a garden, the garden of life. And the fibroids are the weeds in the garden. So when you're trying to treat weeds in a garden, do you get rid of the garden? Or do you spray the weeds and try to do a very targeted therapy? So that's what we're doing here. So uterine fibroembolization is a very targeted therapy to get rid of the weeds, the fibroids.
Okay.
So I really like this slide because it gives you, a sharp contrast between, the options that are available. So you have hysterectomy versus uterine fibroembolization, which is done through a little incision in the wrist about the size of the tip of a pen, something you
in
can
the
put a
wrist.
over.
So this goes through the wrist.
Yes. So we go
Okay.
in through the wrist. We go into what's called the radial artery. If you hold out your hand and feel your pulse, the pulse that you feel is actually through the radial artery. And we want to go into that artery through a very tiny incision about the size of the tip of a pen, something you could put a Band-Aid over. And through that little tiny artery, we go in all the way down to the main supply to the uterus, or to the fibroids, I should say, which are the uterine arteries. And there's one uterine artery on each side. And we go in and we specifically target the areas that are supplying the fibroids and shut down that blood supply in order to kill the fibroids.
Perfect.
So a hysterectomy, again, involves a big abdominal incision. It's costlier, it's painful, it's more expensive. And when we say expensive, we don't just mean, the dollars and cents, but it's actually expensive and takes a toll on the body. And again, there's higher risk of complications, and it can be quite debilitating if any type of complication occurs. As opposed to uterine fibroembolization, it's easier, better, faster, and certainly less costly because you're not staying at the hospital for 5 days. You're not getting admitted to the surgical floor, etc. You're not exposing yourself to all the other bad things that can happen at the hospital, for example, infections, MRSA, etc. So it's a outpatient procedure. You come into one of our outpatient vascular centers where we do this procedure, have the procedure done, and you're back home the same day. If you come in at 8 a.m. to have the procedure done, you're eating lunch at home. That's how quick you're back.
Okay.
So let's see. So yeah, this is what fibroids look like, and for a hysterectomy, big abdominal incision, and this is the fibroids within the uterus are obviously very prominent, and they're being taken out. As opposed to uterine fibroembolization, again, we go in through the wrist. We use our special image guidance to see exactly where we're going into the fibroids, the vessels that are supplying the fibroids. We take our special catheters, our special devices, to specifically target the fibroids and the arteries that are feeding the fibroids, and we stop the blood flow. So here you can see on the bottom right, there's an example of a pre-image and a 6-month post-image. So the fibroid is lighting up. I don't know can you see my cursor at all?
Yes.
Okay, perfect. So you can see the fibroid lighting up here. It's large. It's pressing down on the bladder. So this structure right here is actually a bladder, and you can see that the fibroid is so large that it's pressing down on the bladder, and that's why women experience frequent urination and sometimes incontinence as well. And then after 6 months post-procedure, the fibroid is essentially gone. So we can take a 13, 14 centimeter large fibroid and shrink it to the size of a pea, essentially, by doing this procedure.
That is amazing.
Let's see if I could. So this is an excellent slide too, because it gives you, exactly the perspective of the patient. So at the end of the procedure, this is all you have. You have a little tiny incision in your left wrist, and there's this band that we use to close essentially the incision at the end. This band stays on for about 30 minutes after the procedure. We take off the wristband, and that's it. You can walk around, you can go to the bathroom. If you're feeling any pain after the procedure, you have full range of motion available to you. And then this is, when we're talking about education, it's really a privilege here to be part of this conversation and to be a panelist here, because I think education is the most important thing when it comes to taking care of our body. And unfortunately, there's just not that much education out there for uterine fibroembolization. This procedure has been around for a very long time. It's been around for decades, actually, and the research on it is level 1 evidence, meaning it's gone through clinical trials, etc. It's considered a first-line treatment for treating uterine fibroids. And this is back in 2004, news from CBS when Condoleezza Rice had her fibroids treated with uterine fibroembolization. And now we're in 2020, and still a lot of women, the only options they're given are hysterectomy and myomectomy, which is just, incredible to me. Talking a little bit more about the fibroid embolization procedure, we can go through the wrist, like I showed, but we can also go in through the hip artery. The reason we prefer the wrist, and it's become well established that the primary way to do this procedure is through the wrist, is because of the decreased risk of bleeding, decreased risk of infection, and also the rapid recovery. So like I said, within 30 minutes, you're up and about, you're walking, you're eating, drinking, you're essentially back to your normal self in terms of activity. And if you're having, any type of pain, control with medications that we get. For the procedure itself, we do twilight sedation. So twilight sedation means that through a little IV in your arm, we're going to give you a few medications just to make you very comfortable during the procedure, so you don't have any type of pain. Essentially, from the perspective of the patient, it's going to feel like you're getting a good night's sleep. And then within 20-30 minutes after the procedure, you're wide awake. You're essentially back to your normal self. And the procedure itself is essentially painless. There are, patients who have pain after the procedure, and we give prescriptions for medications to help control the pain. I always tell women, expect to have some pain after the procedure, especially for the first 3 days, but within a week, you should be back to your normal self, back to your normal activities, exercising, back to work, and whatever you need. I've had women who, after the procedure, the next day they're back to work. Some women prefer to have this procedure done on a Friday so that they get the weekend off, and by Monday they're back to work, they're back to their normal activities. So the recovery is just very, very quick. A lot of women ask, what are we putting into the artery to stop the blood flow? So this is what it is. It's called an embolic agent. It's essentially little tiny beads. They're gelatinous beads. They look exactly like this, and they're inert, meaning they don't have any type of reaction with the body. They don't go anywhere else besides the uterine fibroids, because they're specifically sized to go into the arteries that are specific to the fibroids. And the rest of the uterus is completely protected from these beads and from any type of harm.
Okay. And Dr. Before you move forward, I just want to remind the ladies that we will be taking your questions. I see we have we have several coming in, but just hold on. We got a Q&A section right after this. So please submit your question at the Q&A, and we'll get to your questions shortly.
Excellent, Sandra. So I just have this one last slide to kind of drive home the point of what we're doing here. So again, uterine fibroembolization, our goal is to cut off the blood supply to the fibroids, protect the rest of the uterus, and relieve the symptoms that are associated with fibroids, such as bleeding, pain, and pressure. So here, this is an MRI image of a uterine fibroid before the procedure. It's this brightness that's associated with the fibroid, that's all the blood supply that's getting to the fibroids. And it's, again, you can see that it's large, it's pressing down on the bladder, it's pressing down on the bowels. So a lot of women also have constipation. They have trouble having bowel movements because it's hard to, given the size of the fibroids, it's hard to have a bowel movement. This is 3 months after the procedure. The vascular supply is gone. The fibroid is essentially starved for blood. So it's shrinking, and then continues to shrink 6 months after the procedure. And essentially, this will shrink to a pea size to the point that it has no clinical effect on the body anymore. So I think that's my last slide. Hopefully that explains a little bit of what the procedure involves and what to expect.
I think you explained a lot, Dr. Amit. We do have questions. And first of all, let me just say thank you. That was very informative. And a lot of times, we keep talking about the fibroids, or we've been told we have fibroids, but we never see that. We never see what it looks like and what can be done. So I thank you both so very much for today. So now we're going to go to our question and answer segment. And let me just check in and see what we have. So our first question, and it says, are treatment options limited if I have a large fibroid over 12 centimeters, or with additional 3 fibroids in my uterus the size of a 16-week-old pregnancy, and they have very painful symptoms?
I can take that. Not at all. That she's still a candidate. We always check all the other things around it, such as that there's no cancer or anything like that. But yes, I've treated, and so has Dr. Ahmed, patients who've had fibroids the size of a full-grown baby, all the way up almost to the xiphisternum in the chest. So she's a candidate without a doubt.
Perfect. Okay, so the next one is also similar to that. Is it possible for fibroids to be too large for this procedure?
It's the same answer,
Okay.
almost never. The only one that we are usually very careful of is sometimes the fibroid can kind of come outside of the uterus. Dr. Ahmed, if you could share that slide that shows the different types of fibroids at some point.
Absolutely. Let me pull that up for you, Dr. Chopra, so that you can see.
So what happens is the fibroid will grow within the muscle, and it can be either inside, as Dr. Ahmed is showing you. The one that we usually are a little careful about is the one that's called the pedunculated subserosal, where it's outside the uterus. That's really rare, and we do an MRI so we can find that out. And what we look for is that little stalk, that little neck. If it's too thin, then we worry that it may break away, but those are rare. So almost no size is excluded. And the best part of this is, let's say we treat it, the failure rate is very, very low. You can still always have that hysterectomy, but that hysterectomy should not be the first choice. And I've done several hundred of these. I've not had to send one to hysterectomy just yet.
Perfect. All right, so here's our next question, gentlemen. Are there any natural ways to shrink fibroids or prevent the growth of a fibroid?
There is really none. There's a lot of material. I'm spiritual at heart. I call myself a humanist. And holistic means you incorporate everything from diet. So what I would say is there's no kind of magic pill for this, but leading a healthy life, good diet, all that stuff is good. But there really isn't some kind of magic pill to stop it. I'll let Dr. Emma chime in if he has some thoughts on that.
Yeah, I think Dr. Chopra, kind of hit the nail on the head. A lot of women sometimes feel that did they do something to cause these fibroids to grow? Is there something that there's in their diet? Is there something in the medications that they're taking? And the answer to that, is usually no. A lot of this is genetic. That's why, a lot of African American women have fibroids because it runs in families, grandmothers, mothers, daughters, and then their children have it. So there aren't really any, proven natural ways to reduce or shrink fibroids or prevent the growth of fibroids, unfortunately. But again, there's good treatment options out there.
All right, thank you for that. So here's our next question. She asked, if I had a myomectomy, can I still get the procedure? My fibroids are back.
Absolutely. I'm sorry, go ahead, Dr. Chopra.
We both said the same thing at the same time. Go ahead, Samir.
Yeah.
Sure. So yes, absolutely. So if let's say if you're younger and you had fibroids and at that point you didn't know about fibroembolization, for example, and you went and had a myomectomy done. Now the fibroids are back. You still have the option, the same options available on the table. So again, you can get a hysterectomy, myomectomy, or uterine fibroembolization. Again, the fibroid embolization is a procedure that doesn't take away any future options, and it also is not affected by any prior treatments, such as a myomectomy. So I would say yes, absolutely. I actually had a patient not too long ago, probably about 2 weeks ago, that had the exact same, was in the same boat. She was young when she had the myomectomy done, and they had come back over the next 10 years, and now she wanted a less invasive option, and she had a fibroembolization done. She's had good results from that so far.
Okay, perfect. So here's another question about a lot of fibroids. So this attendee asks, so what if I have a lot of fibroids, over 20 fibroids? How will this work?
It's the same. The analogy that we often use is that of a garden in your weeds. Whether you have one or you have 100 weeds, you'll spray the whole garden. So that's what we do here. And we found multiple small ones or one big one, they are still effective. Samir, feel free to chime in if you think, Dr. Ahmed, there's something else to add.
Yeah, no, I think you made an excellent point. I think, if you compare it to a myomectomy is a procedure where you can't target all the fibroids. With fibroembolization, we target every single fibroid. So the way that the procedure is done, it allows us to get rid of all the fibroids that are present, whether it's 20, 30, or 1.
Perfect. So now the next question, can the fibroids grow back even after having this procedure?
The ones that are already necrosed and they are dead, they're gone, those don't come back. Can you develop some new ones? Yes. But like I said, I've done hundreds of these. I've been doing this over 2 decades. And we don't see that at all. Theoretically, if it's not done properly, there's a small chance. So to explain this, the uterus can get blood supply from the right and the left. And if somebody is not careful in doing it and only does one side but doesn't do the other side well, or there's another blood supply feeding it, so that way it's an incomplete procedure. In those cases, it can come back. And Dr. Ahmed, if you could share that slide that shows the blood flow, maybe it'll be a good visual for folks to understand what I'm saying. So done correctly, it doesn't come back because that plant is dead, that fibroid is dead. But if it is for some reason incomplete, or there's blood flow from somewhere else, as you'll see, Dr. Ahmed is showing the artery on the right and the left. and then we hit the whole uterus. So all the fibroids get treated. And if for some reason from one side it's incomplete, then that becomes a problem. But like I said, if 99% of people have zero problems with it, so they don't come back.
Yeah, the one thing that I'll add is in the literature, the success rate for this procedure is 98%. And that's not just that success rate is not based on just imaging findings, meaning it's not based on a large fibroid becoming small. That 98% is actually from clinical response. So how 98% of women see a very significant improvement in their symptoms, which is the most important thing that we're treating, obviously.
I like to follow these patients for life.
Okay.
Get to know the human being. I've had patients I did 18 years ago, are still fine. And I've done this on friends, family, gynecologists as well, gynecologist family as well, and they've done all very well.
Well, ladies, you heard that. It's 98% successful, and you get a doctor for life, okay? Here's our next question. Has the UFE procedure ever been performed on a kidney transplant patient? And if so, is there dye used during this procedure?
Yes, so we use this agent called contrast. It has iodine that the kidney filters out. So if somebody has had a transplant and the kidneys are working well, then yes, we can do it. We use contrast, but we use a very small amount, very, very small amount, not enough to hurt the kidney. And so answer is yes, can be done. You just have to be careful.
Okay, very good. Okay, so this person asks, she says, this is great. I'm loving it. And then she goes, why aren't doctors told about this? And then the final question she's asking is this really safe?
Oh, it's very, very safe. Like we said, if in 2003 Condoleezza Rice could have it, why is it that 20 years later, 17 years later, we're still not talking about it? See, there's a lot of noise. So if there's a lot of noise out there, you don't hear the good music. And there are a lot of forces differently. The commonest thing, as Dr. Ahmed said earlier, why don't a lot of women know about this? Because you see, it's a one and done. You have a fibroid, I treat it, you're fine. So we count on other women to teach other people. That's why we do these kind of talks, that there are safer options out there. Most women, when they have a problem like this, go to a gynecologist.
Mm-hmm.
I have gynecologists as friends, but they do not do this procedure. It's not part of their training. They do myomectomies, hysterectomies. They are used to it. To them, it's a piece of cake. They say, yeah, just have a hysterectomy. Oh, just have a myomectomy. And that's part of the problem. So we've made it a mission to get out there. We've actually just started a not-for-profit organization as well called Sangat Seva, which one of their mission is to provide this kind of education, help patients who don't have the resources for this treatment. But we want our patients to live their best life. And if you've had a hysterectomy, if you have all these challenges, how can you live your best life? So with that in mind, we've been kind of making sure there's a lot of awareness. But I ask each and every woman who knows about this to tell 10 other people, get on social media, tell your sisters, tell your friends. Listen, we talk about so much other stuff. This is important. You don't need an unnecessary hysterectomy or myomectomy. That's the way to do it.
Okay, so we just have, I think, about 5 more questions for you. These ladies are really active today, and thank you so much for sharing, gentlemen. So this young lady said, I had my fibroids removed in 2005, and it was the size of a small ball. 5 years later, they returned 20 to 30 small walnut-sized ones. Yeah. But now the doctor will not do surgery anymore. Can you help me?
Of course, she doesn't need a myomectomy or hysterectomy. That's one of the challenges with myomectomy. She'd be a great candidate for UFE. Easily help her. Samir, you can add to that.
Yeah, absolutely. I think that this kind of touches on what I was saying earlier, that If you've had a myomectomy done before and the fibroids have come back, I think fibroembolization is the best option here, especially when you get to that number of fibroids, 20, 30 fibroids. No one's going to go in and try to do another myomectomy and try to take out 20 fibroids because it's just not technically possible. 20, 30 fibroids, would be very, very challenging for a myomectomy. Your best, most minimally invasive option is uterine fibroembolization. And of course, you always have hysterectomy, but again, there's everything that we talked about with hysterectomy.
I
No,
understand.
it's unsafe to try and do that many. You'll find some aggressive person out there will say, "Oh, I'll do it," but it's dangerous. A lot of blood loss, a lot of challenges. You can have other complications.
Okay. So quite a few questions, gentlemen, about insurance and how does that work? Is it covered by your regular insurance?
Yes, so all insurances cover this. And honestly, if somebody does not have insurance, we find a solution for them. We'll find ways where we can put together some payment plans for them, or if they have Medicaid, we'll take care of everybody one way or the other. And that's another reason why we've started to work with not-for-profits to find folks who can get relief somehow. We're not going to turn somebody away.
That's amazing. Thank you, gentlemen, for that. Okay, so this, and I think you answered this, but she put it in as a question. She may have jumped on afterwards. She said, I'm afraid to go to the hospital because of COVID, as most of us are. So what hospital would I have to go to, and how would you handle this?
Oh, we do this all outpatient. You will not be in a hospital. This is an outpatient. It's our office center. We follow every precaution. We've actually got our own testing now. So we make sure everybody's tested. We take every precaution and we make sure that you're 100% safe. So you will not even get into the perimeter of a hospital.
Very good. Now
So
we have, go ahead, I'm sorry.
I'm going to ask Dr. Ahmed if he wanted to add anything to that.
Yeah, I was just going to say that, this is all done again at our outpatient vascular centers. These centers are specifically designed for treating fibroids and other vascular issues. And they're completely COVID safe. I actually serve as the medical director of the practice too. So, I've worked very closely with Dr. Chopra to ensure that we have all the proper guidelines, et cetera, in place to keep our employees as well as obviously our patients very safe. Because at the end of the day, going to the hospital is, it involves a lot. There's a lot of risk that you take on, but we wanted to create a center that kind of takes away those risks, especially when it comes to COVID. So, we always say that our centers are COVID safe, and we mean that. We work very hard and very long to ensure that.
Perfect. Okay, so we have two last questions, and this young lady lives in Madison, Wisconsin, and she's trying to find out what would she have to do. Do you have a location near her, or would she have to come into Chicago?
So we actually we already do this as a televisit. We are close to O'Hare Airport, so I've been to Madison many times myself, so it's a short ride. I've had patients come from all around the world, and sometimes we'll have them stay locally and in a hotel or somewhere where they're safe. We, like I said, all you have is a tiny little wristband at the end of the procedure. So we'll have to do the procedure here in the Chicagoland area, but all the evaluation can be done via telehealth. Okay. I've had patients come from Florida, California, Eastern Europe, several from Wisconsin, Michigan. We've had them come from all over.
Yeah, I think that's an excellent point, that the only visit that you'd have to make would be for the procedure itself. Everything else, the pre-op, the post-op follow-up, their imaging review, et cetera, all of that can be done remotely. So technically, the only time you'd actually have to come in would be just for the procedure, and the rest of the care can be done remotely.
Perfect. And Well, next to our final question, they're asking, where are you located and what's our next steps? What do I do next to see if this procedure is good for me?
Yeah, so the first step is go to mimithealth.com and you'll check out our locations. You can click on schedule an appointment. You can call us. You can email us. Any way you like, you connect with us. If you can't come in, we can do a televisit, collect all your information and evaluate you. But ideally, if you come in for a consult, that's the best. We'll look at all your information together and go from there. We obviously want to make sure you're a good candidate for this, what the problem really is, exclude anything dangerous, and make sure you're safe. But that's the next step. Your immediate next step, get on the website, call us, click, and connect with us so we can get this rolling.
Okay. So ladies, you've heard, yes, it's covered by insurance. Yes, we can do it. If you are all over the world, you can just come in. And finally, yes, they are here to service you, and they want to make sure, as Dr. Chopra said, they will make sure that they get it done. So whether you're having an issue with insurance or he said that they will find a way to make sure that they take care of you. Final question, the ladies would like to know, is there any way to prevent fibroids?
First is you got to stay healthy. Bad diet won't help you. You know, the adage I live by is that wellness and happiness are not the absence of problems. They're the presence of solutions. And the other thing is, if you quote the Bible, Corinthians 3:16, your body is not your body, it's God's temple. So you don't desecrate it. So good diet, living healthy, not doing the things that are going to hurt you, right? So you take care of that. Is there some magic pill to prevent this? No. But don't ignore the signs and symptoms. If you're bleeding 7 days out of the month, something's wrong. If you're bleeding very heavily, ignoring it is one of the first things. Like we said, you know, just life happens, right? So fibroids happen. So, but when you first find out you got a problem, focus on being healthy, take care of it, and go for it. Because we all God's creation, whatever you want to name it. Even COVID-19 is actually God's creation, but fibroids too. But we have to find a solution to the problem for us to live our best lives. So from that point of view, living healthy, whether you eat a good diet, regular exercise, all in moderation, all in balance is a good way. But when you have a symptom, when you see that something's wrong, don't ignore it. Samir, feel free to add anything to that. If you want.
I couldn't have said it any better than that, Dr.
All right, doctors, I really appreciate you, and I'm sure the ladies appreciate you. We've got so much information. We saw some wonderful examples, some great slides. So ladies, you no longer have to suffer in silence. You can call today to schedule your consultation. Here's the number, 708-486-2600. Again, that's 708-486-2600, or you can log on to MIMITHealth.com. That's MIMIT Health.com, so that you can make your first step to living fibroid-free. Thank you so much, gentlemen. I really do appreciate your time. And ladies, I know they can't see you, but let's give them a big round of applause.
Oh, thank you. It's to hear.
And before we leave, ladies, I do need to ask that you would take a moment and just click on our survey and complete those 4 short questions for you. And again, we want to thank you for your time this morning, and thank you, Senator Hunter and Dr. Ahmed and Dr. Chopra and everyone who was involved on today. We just really want to get this information out. Please share the information. Tell someone about the information, because we are, as African American women, we are #1 in fibroids, and it doesn't have to happen. And that too, we're #1 with hysterectomy. So it doesn't have to happen. We've seen women as young as 25 who have come to us and talked about that they were given a hysterectomy. And we don't want that to happen to anybody else. There's another safe, non-surgical option for you. And today you just heard about it, and I am just asking you to share and tell a friend about this information. So again, you can call 708-486-2600. That's 708-486-2600, or log on to the MIMITHealth.com. That's MIMIT Health.com, so that you can live fibroid free. Thanks again, ladies. That completes our program for today. Don't forget to finish that survey for me, and we appreciate you. Everybody be blessed. Have a wonderful afternoon.
Thank you so much.
Thank
God
you.
bless you.